Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic, and we have a wonderful guest with us tonight. Dr. Haddad is joining us.
I'm here again. Another Wednesday. We're together.
Wednesday. We're partnering up.
Yes.
My partner.
Looking forward to it.
Our Wednesday night show. So, Dr. Haddad, you've talked about some great topics that I love to hear about, with all the different diseases that start in the mouth. That dentistry isn't just for cavities, brushing and flossing, but many heart diseases and even pregnancy problems result from dental care. And we've talked about the amalgam fillings to some of the CERAC machine that you have.
Yep, we've discussed that. We had so many callers about that.
Yes.
And just interested in how you can have a crown done in one day, and the technology is there. So it's been really good. And tonight, I think we're going to talk about a topic that you've been avoiding. Several other shows of ours, and anytime we ever cross into that cosmetic area, you don't. I know that you kind of. In fact, I believe a few shows ago, I believe you even started taking callers to avoid the topic. Now I'm going to push through because I truly believe that you will.
Can we take callers now? Every time you start talking about cosmetics,
I know.
Callers, please.
What? I think tonight we're not gonna take calls. Is that all right? And I apologize to my audience, but there's a reason. You will be happy. Our listeners will be happy because there are inquiring minds are wondering what are the different ways that you can whiten your teeth. Now I know that right away you think people just whiten and it's just vanity purposes, and to some degree it is, but it is also making people feel good about themselves. It's also giving them that confidence that maybe they didn't have before, where, brightening their smile is just what they need to kind of get back out there and have that confidence in themselves. And I think the reason that you may like it, we'll see, we'll discuss things at the end, but this is the most conservative, which you love, and easiest and probably most popular thing in dentistry today. I mean, it really is. And I know that there's a lot of people out there that worry that maybe it's harmful to your teeth. I know that we have a lot of our listeners are very holistic. They don't want to do anything and put anything in their body that may affect them adversely. And I mean, today I truly think. Now, whether or not you're going to go out and whiten your teeth tomorrow, Dr. Joe, I don't know.
I've never done it.
Okay, well, I don't know if you will.
I have never done it. Because you know how even like table salt, we've talked about table salt in the past, how when it's heated to 1200 degrees and they strip all the good minerals and nutrients out of it and it changes the molecular configuration. I'm finicky about that, let alone using a whitener. So you need to prove to me that this whitener doesn't have mercury or aluminum sulfate or something that's toxic for our bodies.
That's very easy to do.
For me to condone it, I mean, I know people want to do it, but I'm gonna be kind of harsh on you about this one.
I welcome the criticism.
Okay.
I do, and I'm ready, and I'm ready, and I've got my ammo ready. So I think one thing that I hear all the time is what are the different ways of whitening your teeth? And there are several different ways. Believe me, I've tried them all. personally. I mean, I really,
have?
yes, I have. I believe in trying a lot of the products that we.
Well, how many times do you whiten your teeth in like a?
That's a good question. The process. Let's take a step back.
Okay.
The process that I recommend is not the. There's two main forms. There's in office. And then there's home whitening, okay? And let's start with the home whitening, which a lot of people I think are familiar with, which is we take impressions of your teeth. We make a custom tray that will fit your teeth intimately, okay? And then we give you certain levels of solution depending on your expectations and hopes of change. And you do this at home for about 2 weeks. We have two different types that we send home now. There's two concentrations of it, and we can talk about safety and all that because this is safe. There is very, very, very few side effects to the whitening process, in addition to the fact that it's only temporary. And the two main ones are temperature sensitivity, which, let me tell you something, I've had in the past, okay? Luckily, the whiteners that we have...
For how long?
Usually just during the process,
okay.
During that 2 week process. And, I have pretty sensitive teeth, or I take it back, I used to have very sensitive teeth before I started wearing my night grinding guard, because grinders out there, and I think people who are listening are knowing, they're nodding their heads right now, have very cold, sensitive teeth. In fact, sidebar, if you do have very cold, sensitive teeth, and nobody's ever told you that you grind, there's a good chance that you are. So, just so you know, teeth should not be sensitive. You should be able to eat and drink and live your life without even knowing that, your teeth are there, essentially, So that's a little sidebar. But as far as that goes, people with sensitive teeth, going through the whitening process can be, to a degree, painful. And so the solutions that we recommend in our office actually have fluoride in them. Now, I know what you're thinking already, because I know fluoride is something that you don't really love. Okay,
well,
this is something that is very, very low level, and what it does is it actually combats some of the solution, protecting your teeth, and actually helps the rehydration process. Because the main reason that you get sensitivity when you're whitening is your teeth are dehydrated, okay? And then there are the dental tubules that are part of your tooth makeup structure are opened, dehydrated, and that's where the cold air or liquids and things like that come out.
Probably when fluoride would be very effective then.
Very, very effective. In fact,
I'm not, Jeff, personally, I'm an advocate of using fluoride topographically. It's the water, I really wonder, why is it in our water? I'm not a real big fan of that. But anyways, I know that's a side topic.
I'll tell you, though,
that's in another show.
We should. I think we should, because I think a lot of people are wondering that. And I can tell you right now, and for those of you who are listening right now, topographically, meaning topical fluoride really is more important than systemic anyway. So if that makes you feel better. There have been studies as recent as even 2005, which, I was taught differently. I was taught that you needed to give children supplements so that they were getting the optimal amount of fluoride in their diet for their teeth to even be healthy. And so that's not true anymore. We don't even give supplements anymore. Hopefully they're getting enough in their diet, which we can cover. There's a lot of great foods that have fluoride in them, naturally. And when we have the topical fluoride at your dental office, which is a very important part of life, or maybe some rinses that are over the counter, that is enough to keep your teeth healthy. You don't have to ingest the water. So if that makes you feel better about it.
Hey, so Dr. Jeff, what want to get into what is in the whitener? I want to know the ingredient.
It's sodium fluoride, okay? And this fluoride is an element that is actually what I think what we should do is
what's that?
Scratch that.
Scratch that, okay.
Can we scratch that?
Okay. Stop. Cut.
Cut.
We're gonna splice in. Okay, let's start. We're gonna start with what is in the whitener.
Why don't you ask that again? We'll stop that question again. I'm sorry.
Okay, ready? On your mark, get set. So, Dr. Haddad, I want to know, what is in the whitener? What is in the whitener?
No, that's a good question. There's the main product line out there, whether it be over the counter or even in office, is a hydrogen peroxide. And
hydrogen peroxide.
Correct. And that's it. And then
water is H2O.
Correct.
hydrogen peroxide?
H2O2.
So it's basically just water in an unstable state.
That's correct.
Well, I'm on board with it. There's for anti-cancer and cleansing at health food stores, you can get a food-grade hydrogen peroxide. Mm-hmm. Are you aware of that?
I did not know that.
Yeah. So I mean, you don't want to go to the drugstore, CVS or somewhere, or Perry's,
right.
and buy hydrogen peroxide and chug that down. That is that's not good for you because it's not food grade.
And I can't imagine it tastes very well either.
No, but actually, if you get food grade hydrogen peroxide, it's just water in an unstable state, and it effervesces and cleans, and you can put it like if you have ear infections and things like that. I like to get the food grade hydrogen peroxide.
Oh, that's good.
So so what else is in there besides hydrogen peroxide?
Really, and I'll go one step further. The main product that I recommend really is actually carbamide peroxide, which is a different form of hydrogen peroxide. It actually is a more stable form. It keeps it stays, it doesn't break down as fast. But the byproduct of it breaks down into hydrogen peroxide.
I see. So it's just a slower breakdown.
In addition to the fact that it's not as,
more like a complex carbohydrate compared to a simple sugar.
Correct.
So it slows down the breakdown of the hydrogen peroxide. Okay, so what's happening, I'm assuming the hydrogen peroxide basically it bubbles.
Cleaning exactly.
It scrubs and cleans.
You got it. And so the
okay.
So now let me tell you the main thing that people are concerned about is, does it do anything to the teeth, from a irreparable standpoint, is it causing harm to the teeth? And it's not. There's the temporary sensitivity you have goes away. It's not eating away your enamel. The only problems with some whiteners, and this will kind of, I guess, segue into maybe the over-the-counter products, is if you get it on your gums and it's on there too long, you can actually get a chemical burn there. And that's actually happened to me before, personally, and you have to be very careful. That's why when we make these custom trays, they are very, very accurate. But we also recommend we put a little bit of that solution on the tooth, and then you take a little tissue and you rub that away from your gums, because you don't want it sitting on there. And when we give this to people, you may have even heard people talk about, I whitened last night. I slept with my trays all night long. That was an older style of whitening. And to be honest, there are some dentists that still advocate that. I don't anymore for two reasons. One, it's really a pretty disgusting process, to be sleeping with them all night. And I've done it. Now, I also worry about people ingesting that. When you're sleeping, who knows what's happening, when you wake up, of what you're swallowing as far as that goes.
So, Jeff, if I could interrupt, you said that one thing it can cause, done improperly, it can burn the gum, like hydrogen peroxide, it can burn, over dry, and burn the gum.
Correct.
So I have a problem with that a little bit, because that can lower your immune system. Never good to have inflammation. Burning lowers your immune system.
I agree.
So, because I do have a lot of patients who have done it, get the over-the-counter whitening solutions. That makes me a little nervous, you might say.
Yeah, no, I think
concerned.
That's really good. I'm glad you bring that up. It's a good point. The main difference between the home over-the-counter products and your home trays made by your dentist is the strength of the solution and the trays that they're delivered in. Okay, when you buy something over the counter, it's not as strong as the stuff that we have, which is a good thing, but you're not going to get the results that a lot of people are looking for. Okay, but more importantly, goes to what your worry is. These are ill-fitting. These are one-size-fits-all type delivery systems, and they're
it's a good way to put it. So you're trying to deliver this hydrogen peroxide, H2O2.
Right.
And it gets on the gums,
correct?
Not just the teeth. So you're not just getting it on the teeth where you want it.
And when it gets on the gums, you can get literally it's a chemical burn. And we advise our patients exactly how to avoid that with our custom trays. And unfortunately, when it's unsupervised, when you're buying an over-the-counter product, that is a risk. So to be honest, Joe, when a lot of people say, obviously the over-the-counter, the Crest white strips and things like that, they're very inexpensive. So that's very appealing to people. And I appreciate that. I recommend Crest white strips to teenagers, maybe people in their early 20s. Anybody after that, unfortunately, life has, taken its toll on your teeth enough. Those things are not coming off with that level of solution. So I wouldn't want you to waste, even though it's inexpensive, you truly could be wasting your money depending on what your expectations are.
Well, what would be the downside as you get older of using the white strips?
No downside. I just worry that you're not going to see as much of a difference. If you're looking for just a very subtle change, then give it a try. It's not, and I've recommended that to people. Give it a try. But if I know the person and I know what their goals are, I say, listen, you're not going to get those results. It's just not strong enough. The potency isn't there.
What is on the strips? Is that just?
It's a hydrogen peroxide chemical, obviously in kind of a adhesive gel. So there's some additives in there. I don't know exactly what it is, but it's an adhesive gel.
If you're going to use the strips, I'd like to know what those additives are.
Yeah, and I don't know that.
What you're using if you're just using the.
Obviously, as a dentist, I want to be able to supervise my patients. I know what works. I know what doesn't work, And, for instance, something that we offer at our office that I really don't recommend to people, but if somebody really, pushed me on it, I would give them the pros and the cons, is what people call the laser whitening. You've maybe heard of that, right?
Yeah. So let's talk about that.
Yeah, I mean, that's
that actually kind of intrigues me a little more than using any solution.
Well,
although I got to say, this carbamide peroxide, hydrogen peroxide, I don't have a problem with that. With the Crest whiteners, I probably would have a problem with the additives that they add to it.
And, again, the fact that the trays don't fit perfectly, you have a chance to ingest that stuff. Again, there's pros and cons to everything, but as far as the in-office, I'll correct you there.
I'm going to say, if you're going to do something like cosmetic, do it right.
I think so too. I mean, I've always thought that, and I wouldn't want anybody to ever feel like they didn't get their money's worth for anything. That's buyer's remorse. And again, if a 40-year-old man who's a heavy coffee drinker, red wine, all the things that stain a white shirt, pretty much all the good things in life, right? Except for smoking. If he said, I'm going to give the Crest white strips a try, I said, well, listen, Mr. Smith, please save your money. You will not. There's really going to be very little benefit to you doing that. If you truly want to make a difference, honestly, you're going to need to do one of our office treatments, whether it be a home whitening or this in-office, which we can talk about. The laser whitening.
So the laser,
it is still the solution, okay, just so you know. We actually apply that hydrogen peroxide right on the teeth, and then the laser is supposed to enhance and stimulate. And to be honest, they've found, there have been studies, that light pretty much doesn't do much. Okay?
Oh, really?
Not at all. They did many studies where they putting the material on the teeth with or without the light. There was very little, if any, difference or improvements. Okay? Now, here's the pros of it. Okay? It does happen a lot faster than the home whitening. So if you said, you know what, Jeff, you've made me a believer. I want to whiten my teeth, and I've got a wedding this weekend. What would you recommend? Well, then I would recommend our in-office, which we use a product called Zoom. It's a very good product. But what happens with these in-office laser whitenings, and this is for anybody out there who's considering this, please know that if you have the in-office laser whitening, it does not last as long. And I never felt comfortable with that.
Now, why is that?
Because it's not on the teeth long enough. It's not, the home whitening that we use, 2 weeks. Either a half hour or an hour a day for 2 weeks, okay? That's what they have, that amount of time. Wow. When we have them in the chair, they're in there for about an hour and a half. It's just not on long enough. It gets things white real fast, very fast, which is good, but then it will subside relatively quickly. So what and this isn't what all dentists do, but this is what we do. I do not like my patients being unhappy, ever. And so if they're going to spend money to do that, what I do is I actually make trays for them as well. So they have the in-office Zoom whitening. You're going to be ready for your wedding this weekend. And then I give you some trays that you follow up for the next about week or so using the solution, a similar solution, so that we can have that lasting effect. Because I know that we were talking earlier about how long does it last? How often do you have to whiten? If you go through the whitening process, you should never have to go through the full whitening process again, ever. So now, that said, we do boosters. Okay. But we'll never have to go through that full process.
The full 2 week.
That's correct. So I probably whitened my teeth the first time, I don't know, 8-10 years ago maybe, and once a year what I'll do is I'll use the same trays that I had, and I'll do it for one night, maybe 2 nights in a row, and it brings things right back down to that base white, which is pretty cool.
Yeah.
You never have to go through that again.
So it's just once a year.
Right, and and believe me, I am no saint when it comes to avoiding things that stain your teeth. Okay, I'm kind of a bad boy. I've got habits just like everybody else. I love my coffee and some red wine here and there. These are things that obviously stain your teeth, but and everything in excess, is bad. We know that everything in moderation is good. And again, if you do whiten your teeth, here's the recommendation. People ask me, well, what's the way I can give the best results? For those 2 weeks that you're maybe doing the trays, I want you to avoid anything that stains your white shirt, okay? If you can. Cut down on your coffee or lay off it. Cut down on maybe your red wines. Obviously, if you're a smoker,
never a bad day.
If you're a smoker,
bad thing to fast for
a couple weeks,
things,
you're going to get the best result. And the other thing that I would highly recommend, the best whitening results we get right after a cleaning. Get in with your hygienist. Have your dental cleaning done. Your teeth are as clean as they're ever going to be, and then start whitening that night. And we've just seen amazing results, Cool. So it is, listen, it is something that I know that we've talked about, and it's a cosmetic thing. But, Joe, I see people who are afraid to smile. They're afraid to laugh. They're afraid to, let their personality be, as open and extroverted as they want to be because they're trying to hide their teeth. And for something as simple as a conservative whitening treatment, if that can change somebody's personality, give them a little bit more confidence, I'm a big supporter of that. That's a quality of life thing, and we do things like that every single day. And you want your patients to look and feel good, and from a posture standpoint, right? And so think about if maybe your smile was holding you back in life. I know that the cosmetic thing doesn't really, get your rockets, going. No. But I'm going to tell you, the people that we've changed their lives with, by making their smile better, it's a great gift that we give to our patients.
Yeah,
so
I can see that. Hey, I know we're starting to run out of time, but I would like to ask you this. And one thing that I did as kids once in a while was baking soda and salt.
Okay.
And brushing with that. Mm-hmm. What are your thoughts with that? Does that wear out the enamel? I didn't do it later. I thought this is this going to wear your teeth out? Or?
Yeah, in general, you need to understand the enamel on your teeth is harder than your bone. It's the hardest substance on your body. The problem is that as we go through life, we wear that enamel down, whether it be just through normal life or, again, back to those grinders out there. Right. Severe grinders, they go past the level of enamel, and they're into the dentin, which actually wears 15 times faster than enamel.
Boy.
Okay? Yeah. So depending on the person, if somebody had very severe wear, I would stay away from abrasive things like that. There's some, since we're talking about whitening toothpastes, people always say, do they work?
Right.
Well, listen. Do they work? Sure. You may see a little subtle differences. They're going to be subtle, but they work differently than the whiteners. There's actual added abrasiveness in there. You're actually whitening your teeth by that abrasion, not as much as the material being in touch with your tooth, because it's not on long enough. You're just brushing for 2 to 3 minutes, or sometimes people are a lot even less than that. It's not on there long enough. So that's where it comes in. There's some toothpaste out there with baking soda, and there's obviously something to that. But in all seriousness, don't brush hard. People, we recommend only soft toothbrushes.
Don't brush. Now, is that for the gums, the sake of your gums?
Everything, especially the gums. People think that getting aggressive with their toothbrushes means that they're doing a better job. It's not. You're usually doing more damage. And here's a little tip for everybody. When you do your little cram session right before you come in to get your teeth cleaned for the 6 months, and you're sitting there just going to town on things, and when you walk in and we see your bleeding gums, we know what you're doing, okay? So, you can't make up. This isn't cramming for a test like we all did in school. Right. You need to behave yourself the whole 6 months. And, take it easy. We're talking the soft brushes and any toothpaste out there, so whether it be a whitener.
Recommend soft toothbrush.
No question about it. Yep, you're just doing damage at that point. There used to be the firm and the hard bristles, and even they've medium out there. Again, you need to just, as long as you're brushing and you're brushing the proper way, you're going to be great. Doing it harder or more aggressively is not giving you any benefits at all. So take it easy out there, people. You know, your gums are your friends.
So when you are brushing, are you actually brushing your gums or your teeth?
Both. Absolutely. You want to angle your brush essentially at about a 45-degree angle so that the bristles are literally massaging right underneath the gums, right where your tooth ends. That is where plaque accumulates, and that's where you start having some issues. Now, we've talked in several other shows about, is brushing enough? Brushing is not enough. I think I've said this before. Do you have to floss? Well, I would recommend you only flossing the teeth that you want to keep, okay? Because flossing is that important. You need to floss. Floss one time at night a day is enough. Brushing 2 to 3 times a day, though, that's the key. And again,
2 to 3 times a day brushing?
Yep, absolutely. Once in the morning, once at night. And I advocate if you're able to during the day, why would you not? I mean, there's some people who can't get away to a toothbrush, and there's a lot of people who can. That extra time could be the difference between you getting a cavity and not, or getting into a gum situation or staying healthy. So, if you think about a 2 or 3 minute little brush session, it could be worth your time just to take a pause and take care of it.
Especially after eating food that might be getting lodged into.
Absolutely. And then this, and depending on how your diet is, some people's diet are not as good as yours, Dr. Joe,
right.
Some people are misbehaving maybe a little bit, like myself, and if you do have a high sugar diet and things like that, again, you better be brushing more, because there's only 2 reasons you get cavities, okay? Oral health neglect, meaning, bad oral hygiene, or bad diet. This isn't a hereditary thing, We have good teeth to start with, okay? You don't inherit bad teeth. You usually inherit bad habits. You got it.
Well, that's a good one. You don't inherit bad teeth. You inherit bad habits.
You got it.
All right. So in recap, you're saying that the whitening that you use is basically it's carbamide peroxide, which breaks down into hydrogen peroxide,
Correct.
which is H2O2. Is pretty safe.
Very.
And that your custom trays allow it to just be delivered to the teeth and not have a burn the gums
Correct.
to damage the gums. And you do it once, and then you just once a year you do a booster.
A little booster. And some people don't even do the booster. You know what I mean?
I'm on board with that. I'll have to give it more thought before I
go down that road.
But
well, I want the listeners to know that the day that we give you your smile
teeth
enhancement,
are pretty yellow,
we're gonna no, I didn't say that. I said when we decide to, we're gonna get a nice picture. We're gonna put it on the website, The Simple Truth for healthyliving.com. You will get to see Dr. Joe's beautiful brightening smile.
Until then, I'm gonna smile with my mouth shut, I guess.
No way. I don't think I've ever seen you do that. You're too happy of a guy.
Hey, thanks, Dr. Jeff, for joining us, and I can't wait till you're back next week.
I'll be
Partner up here, buddy.
Thanks for having me.
All right, and remember, in all that we eat, drink, or do all things to the glory of God, and have a wonderful night's sleep. God bless you.
You're listening to Simple Truths for Healthy Living with Dr. Joseph Kanu of Rochester Chiropractic Clinic. Get ready to call. Get ready to learn. Get ready to live, feel, and be better with Dr. Joe. You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.